Her experience about this condition, and I would welcome her here. Dr. Wallace.
Yay!
Good afternoon, Endo advocates. I'm honored to be here. I would like to talk with you today about the form of endometriosis that can quickly become a medical emergency. It involves blood in a place air is supposed to be. I'm going to tell you about my experience, but let me tell you what it's collectively called, thoracic endometriosis syndrome. And there are 5 presentations. There are endometriosis lung nodules that sit there and wait, I call it, for something to happen or to become catamenial. I want you to get familiar with that word. There's catamenial hemothorax, catamenial hemoptysis. That's when you cough up a teaspoon to a cup of blood. There's catamenial pneumothorax and catamenial hemopneumothorax. My first presentation was catamenial hemothorax. I had 3,600 cc's of blood on my right lung. 7 years later, I developed a catamenial pneumothorax. I had to have a section of my lung removed, a procedure where they scrub the back of the lung and attach it, and a week later it collapsed again. This is menstrual lung collapse. I had a near-death experience due to this catamenial hemopneumothorax. After my surgery, some of the lung was scarred down, some of it wasn't. The lung collapsed again. By the time I got to the hospital, they had to rush me in, put in an emergency chest tube, and the next day, my left lung almost collapsed. Now I want to stop right there and say, the physicians have a very difficult job treating endometriosis. Going forward, awareness is peaking. But we want to educate. And there are many people out there who have never heard of this. So we want to educate, not humiliate or alienate. Because the doctors, after I found out about this, I didn't know. I would always go in and not intimidate, but I was so happy to tell everyone about it. And the doctor that saved my life that day was the one that I had tried to explain and didn't understand. But I want you to know, in your greatest time of need, you want those physicians standing right there. They have the technology, and I want to give you a few symptoms. Shortness of breath, chest pain. Sometimes there's no pain, sometimes you taste blood. You may not cough it up, but you may taste blood. We're all figuring this out together. So figure it out for yourselves, my lads. You were born with all the great have had. With this equipment, they all began. So dream great dreams and say, God can. Look them over, those wise and great. They take their food from a common plate. With similar knives and forks they use, with similar laces, they tie their shoes. The world considers them brave and smart, but you have everything they had when they made their start. You can triumph and come to skill. You can be great if you only will. You're well equipped for whatever you choose.